For the past couple of weeks, coronavirus has been all over the news. And based on the forecast from experts, that's not really likely to change anytime soon. Now, at this point, most of us have heard the warning that the best way to avoid the illness is to avoid large gatherings. We can avoid large gatherings like concerts, conventions, public transportation, and crowded shopping areas. But there's one gathering that's a lot harder to avoid: work. Hi, I'm Rachel Walla with Ally Safety, and in this video, we're going to talk about OSHA's tips on preventing the spread of coronavirus in the workplace. So, without further ado, let's jump right into it. Last week, OSHA published a document called Guidance on Preparing Workplaces for COVID-19, or as most of us have come to know it, coronavirus. Now, since most of you won't have time to go through the entire document, I've pulled out the highlights that apply to all workplaces. First things first, develop a plan. The coronavirus is a respiratory illness that began in China and has since spread throughout the world. Due to the level of outbreak, it has already impacted major world markets and many aspects of daily life, as a lot of us have noticed. The coronavirus is mainly spread from person to person. This can happen between people who are in close contact with one another and through respiratory droplets produced when an infected person coughs or sneezes. These droplets can land in the mouths and noses of people who are nearby or possibly be inhaled into the lungs. Also, it may be possible that a person can get coronavirus by touching a surface that is infected and then touching their own mouth, nose, or possibly eyes. But this is not thought to be the primary way the virus spreads. People are thought to be the most contagious when their symptoms are the most severe. The first step your business should take is to conduct a risk assessment that's specific to your type of work. The purpose of the risk assessment is to understand the level of risk that your employees may be exposed to, and also to identify the tasks that present the highest potential for exposure to the virus. OSHA's guidance document outlines 4 different workplace risk levels for COVID-19. Very high, high, medium, and lower risk. Very high risk applies to those jobs with high potential for exposure to known or suspected sources of COVID-19 during specific medical, post-mortem, or laboratory procedures. This includes healthcare workers treating coronavirus patients, laboratory personnel collecting or handling specimens from known or suspected coronavirus patients, and morgue workers performing autopsies. High exposure risk also includes jobs with high potential for exposure to known or suspected sources of COVID-19 during specific medical, post-mortem, or laboratory procedures. The difference is, this category applies to healthcare workers and support staff who must enter coronavirus patient rooms, medical transport workers, and mortuary workers. Medium exposure risk jobs include those that require frequent close contact, meaning within 6 feet, of people who may be infected with coronavirus, but who are not known or suspected patients. Now, this group can include employees who have frequent contact with international travelers or the general public, like those who work in schools or high-volume retail settings. The last category is lower exposure risk. This applies to jobs that do not require frequent contact with people known or suspected of being infected with coronavirus, or frequently interacting with the general public. Workers in this category have minimal contact with the public and other coworkers. After assessing the risk, decide on the most effective steps you can take to reduce the potential for infections to spread in your workplace. OSHA's guidance document gives specific examples of hazard mitigation steps that apply to each level of risk. Now, for the purpose of this video, we're going to focus on the steps that all employers can take that will help to prevent the spread of coronavirus in the workplace. But if you would like some specific examples of what you can do based on your specific risk level, OSHA has included that guidance in the document, which is linked in the description tab below. Here are 4 steps that all employers can take to help prevent the spread of coronavirus in the workplace. One, develop a plan to prevent infectious disease and a plan of how to respond to cases in the workplace. The plan should include the level of risk at various work sites and in specific tasks. Also, what controls are necessary to address those risks. It should also look at how to account for increased employee absenteeism, how to socially distance employees through staggering shifts, working remotely, and other measures, and how to respond to interrupted supply chains and delayed deliveries. Number 2, prepare to implement basic infection prevention measures, such as frequent hand washing, providing hand sanitizer that contains at least 60% alcohol, encouraging employees to stay home if they're sick, reminding people to cover their coughs and sneezes, providing customers and members of the public with tissues and trash receptacles, exploring whether flexible work policies like staggered shifts, working remotely, and conducting virtual rather than in-person meetings is a possibility, implementing good housekeeping and making sure routine disinfection of surfaces and equipment is taking place. Number 3, develop procedures for prompt identification and isolation of sick people if appropriate. What this could look like is encouraging employees to self-monitor for signs and symptoms and reporting when they are experiencing symptoms. If it's appropriate, you may want to develop training and policies to move potentially infectious employees to a location away from other workers, customers, and visitors. Number 4, the next step is to develop, implement, and communicate about workplace flexibilities and protections. Now, what this means is to encourage sick employees to stay home. Make sure that sick leave policies are in place and are also consistent with the public health guidance, and that employees are aware of these policies. Talk with companies that provide your business with contract or temporary employees about the importance of having sick employees stay home. Don't require a healthcare provider's note for employees who are sick with acute respiratory illness to validate their illness or to return to work. Maintain flexible policies that allow employees to stay home to care for sick family members. Be aware of workers' concerns about pay, leave, and other issues that may arise during infectious outbreaks. Work with insurance companies to provide information to workers and customers about medical care in the event of an outbreak. Additionally, you may want to consider the following mitigations based on your specific areas of risk. Engineering controls, installing high-efficiency air filters, increasing ventilation rates in the work environment, installing physical barriers such as plastic sneeze guards, using a drive-through window for customer service. Administrative controls, discontinue non-essential travel, develop emergency communication plans, provide workers with up-to-date education and training, and post hand washing signs in all restrooms. Personal protective equipment. Depending on the specific circumstances of your workplace, consider offering face masks to all employees and customers. Provide latex gloves or other PPE where necessary. Remember, the first step is to identify your level of risk and then apply the controls that make the most sense for your specific workplace. As the saying goes, an ounce of prevention is worth a pound of cure. Thanks so much for watching, and until next time, I'll see you later.